2001, at the age of 42, it looks like Simon has a low juvenile hairline with strong anterior temporal projection. He has low-set flat brows and upper lid hooding, which is relevant to his recent procedures, as you'll see later on. He also has this lower lid tear trough hollowing and crow's feet as well, which are wrinkles at the under eye area. Simon looks to have thin lips, and he has a strong chin. In 2002, at the age of 43, it looks like Simon has mild jowling as well as mild neck fullness. In 2003, at the age of 44, Simon has the descent of his lateral brows, meaning that the lateral brow is lower than the medial brow on the horizontal axis, and this is due to the lack of upward pull by the frontalis mass muscle lateral to the temporal crest. In 2004, at the age of 45, I see no change. In 2005, at the age of 46, it looks like Simon has started to receive Botox into his forehead and glabella, which he has admitted to. In 2006, at the age of 47, I see no changes, and that's the same through 2008. In 2009, at the age of 50, it looks to me like Simon may have started cheek filler around this time. His cheeks just look fuller, and there's just this expansion of his face that I'm seeing with likely the use of filler. In 2010, at the age of 51, I am seeing some aging-related changes, such as the lateral canthus is now lower than the medial canthus of the eye, and this is not the case in youth because normally the tears have to flow from lateral down to medial into the nose. So that's why the lateral canthus is naturally in youth positioned at a higher level, but as we age, it tends to drop down. In 2011, at the age of 52, I see no further change. In 2012, at age 53, there are some obvious signs of continued Botox use with limited lateral frontalis injection, meaning that they're injecting the frontalis muscle, but not all the way to the side of that muscle. And that's why he still has those lateral wrinkles that are pulling his lateral brow up quite high. It looks to me like Simon may have either gained weight around this time, or the continued use of filler has given him that larger, fuller look to his face. Some people call it filler fatigue. And keep in mind that there is a migration of filler that occurs over time as well as more of a permanence to HA filler than we previously thought. There have been MRI studies that have indicated this, that filler, including HA filler, tends to hang around much longer in our bodies than we had previously thought. It may lose the aesthetic impact of how it looked initially, but it doesn't mean that the filler is completely gone. It can take many, many years before it starts to really break down. Also, it looks like Simon has additional neck skin laxity and some extra adiposity, which is basically fat deposits. Subscribe now for the ultimate face swap party. Our channel is like a Hollywood plastic surgeon's dream, but with more laughter and fewer scalpels. Let's face it, you won't want to miss a single transformation. In the neck in 2013, at the age of 54, I see no signs of change. Same in 2014. In 2015, at the age of 56, Simon has worsening brow ptosis, which is a sag of the brows. This could just be age-related. It could also be because of the continued use of Botox in the forehead muscle, since that's the only muscle that actually lifts the brow. So if you're paralyzing it over time, it gets weaker. Also, he has some upper eyelid dermatochalasis, which is excess skin of the upper eyelid, and he possibly also has some eyelid ptosis. And to me, it looks like he may also have functional visual field loss, given this extra weight that surrounds his eye. It might be even affecting portions of his vision. I think Simon has also continued to get cheek and under eye filler. In 2016, at age 57, I see no change. Same in 2017 at age 58. In 2018, at the age of 59, it looks like Simon is starting to lose some weight. In 2019, no change. And in 2020, at the age of 61, I just wanted to point out here that Simon is starting to develop these platysmal bands in his neck. And this is due to some midline dehiscence of the neck muscles, specifically the platysma, which is the most superficial muscle of the neck. In 2021, at the age of 62, it looks like Simon has continued to get cheek, under eye, and maybe even some lip filler, and in May of 2021, there were really no signs of upper face surgeries, but one that was a major change on top of the filler that he was already dissolving. It's common practice for people to offer an explanation of their aesthetic change that's only a fragment of the actual truth. We've seen that many times. In September 2022, age 63, Simon was actually on camera with Sofia Vergara for Wired. Take a look at this. It looks to me like around this time he already had a lateral brow lift, upper blepharoplasty, maybe a lower blepharoplasty as well with canthoplasty, and his upper eyelid just appears more hollow. And that's due to the combination of likely brow lifting and aggressive upper eyelid skin removal. December 2022, age 63 of 2022. It's not the first time that we've seen these changes, but as his face has gotten thinner from the filler dissolving, the combination of the eyelid and brow surgeries with the dissolving of the filler makes it a lot more jarring to our eye. Keep in mind the effect of filler on your face. Dissolving filler can thin out natural tissues, especially if high doses of hyaluronic acid are used. Hyaluronidase is not only selective to exogenous HA filler that's in the filler syringes, it also has the ability to affect our natural tissues since we have hyaluronic acid in all of our cells. I have a few thoughts on why Simon Cowell's recent facial changes went viral. Men rarely get smaller surgical tweaks along the way, so when they get a major overhaul, it's a lot more obvious to us. Any changes around the eyes need to be done with great care and calculation because they can really distort or change and affect the way that our face looks. It's more than acceptable to do a brow lift first and then see if you even need to remove any upper eyelid skin. Sometimes that process can be done on the same surgical day, and sometimes you do the brow lift, let it heal, and then see where exactly the eyelids fall to, then potentially go back and remove some upper eyelid skin. Upper blepharoplasties can generally be done under local anesthesia, so it's not a difficult add-on procedure after you've made sure that the brows are exactly where you want them. The total cost of all potential procedures for Simon Cowell is $210,000. And here's what a before and after looks like since you like.